Let's talk now to Tom Levitt on the doctors' strike, because of course we've got day one of the doctors' strike. The junior doctors are out for 5 days. They started at 7 a.m. We checked in with our picket line watch at 7 a.m. and there wasn't anybody actually on the picket line. So who knows if they're just like fancying taking a bit of a long weekend off. Let's talk to Tom Levitt, though, former Labour MP and founder of the Sector 4 Focus organisation. Tom, very good morning to you.
Good morning, Mike.
Good to talk to you. You believe that this is all a hangover from the previous sort of 14 years, I guess, and money's not being spent properly in the NHS. The thing I find astonishing about the NHS, and I've lived a long time in this country, as you have probably, wondering why, with so much money flooding into it, it doesn't seem to work very well.
Well, the NHS is one of the largest organisations in the world. And the issues of managing an organisation that size are huge.
Yeah.
And it was set up in 1945 with the in 1948 with the vision that not many people would live beyond 70, and those who were over 65 would be looked after by their families. And quite honestly, the structural changes in Britain have not yet been fully recognised in the way that the health service operates.
Yeah.
I want to see a health service that is focused on stopping people getting sick in the first place, rather than being just there as a safety net once they fall. And that sort of change takes a long time. You can't deliver that in just the first year of government.
Yeah, but why is it so inefficient, and how can nothing be done seemingly about that? Because in my mind, it's become more inefficient over time, and I'm assuming that's partly because there's more people now being seen by the NHS. There's more people in the country. The population is bigger. You know, I remember growing up in a country where you know, my doctor when I was a kid used to come to my house and see me if I wasn't very well, which doesn't happen anymore.
Well, that probably wasn't a hugely efficient use of that doctor's time, to be fair. My last...
Well, it was, as far as I was concerned, when I was a child.
Well,
I was rather happy about it.
The health service isn't built around you, Mike, unfortunately. We have to cater for
that's where they're going wrong, obviously.
Yeah, absolutely. Especially a population that is getting older. And as people get older, as chronic diseases get more widespread, conditions like diabetes, cancer, and so on, these are all issues to do really with the way society operates, and it reflects the fact that we're not focused on health as much as we should be. But look, you've just had Harriet Baldwin on, a former Treasury Minister, and she oversaw the period in which the NHS was underfunded. She oversaw the period in which the doctors,
but it's not underfunded, though. Come on, Tom. I mean, they get £200 billion a year. I mean, it's a massive, massive amount of money.
As I say, it's one of the 3 or 4 biggest organisations.
Yeah, but you can't. Yeah, but I'm not buying the underfunded argument, because, you know, the one thing it has is lots and lots of money. What it doesn't have is anybody who knows what to do with the money.
Well, you asked me to come and talk about the doctors' situation, and they show figures that show how far they've fallen behind. They obviously didn't have the guts to take on a Tory government. They think a Labour government would be a soft touch. That's
well, hang on, they were on strike for nearly an entire year when the Tories were in charge.
They had a 20-odd% rise last year, which was absolutely unprecedented. That recognised the fact that they've been underpaid for years. They've had the biggest pay offer in the public sector this year, and I really hope that what you've seen this morning, and you've just reported of nobody on the picket line, I hope that shows that doctors are voting with their feet today and not actually coming out on strike in the way they did before. Because, you know, you can't expect miracles. You can't expect everything to have changed in the first year of a Labour government. Judge the government after 5 years. That's the time to do it.
Yeah, but I'm not judging the government in this conversation. I'm judging the NHS in this conversation. And what I'm asking you is, why can nobody seemingly make the NHS work more efficiently? Because that is the real heart of the matter at the end of the day. You know, it's not underfunded. I'm not buying that in any way, shape or form. They've got loads of money, but what they do is they waste it. And I talk to people who work in the NHS all the time, and I can give you hook, line and sinker any number of arguments about why, when you open a cupboard, there are things in there that have been there for so long that they were purchased at ridiculous prices years ago and they were never used. You know, the fact that, you know, when they open a packet of pills and give one to somebody, they then have to throw the rest of them away. You know, the number of inefficiencies in the NHS are legend. Nobody seems to know how to fix that.
Well, let me tell you this, Mike. The last two times that I've been to the urgent care in my local hospital, I've been in and out within an hour. The last three times I've needed a GP appointment, I've had that on one occasion the same day, and on the other two occasions the very next day. So there are parts of the NHS which work better
Well,
than others.
you're a very lucky man in that case, because I speak to people every day on my show, and I've got a whole load of them here who've got stories about how that is precisely not what happens to them.
Well, that's probably because lucky people like me don't complain to the media.
Well, it's not about whether you're lucky. It's about the fact that you are lucky if you get treated quickly. You are lucky if you can get an appointment with a GP. You are lucky if you've got a dentist in this country. You are lucky if you haven't had to wait 6 months or more for an operation, because most people have to do that.
Well, you raised the question. You raised the issue of luck, but no, you're right. It's
Well,
not good
you
enough.
just said you were lucky. You actually raised it, to be honest.
You used the word first. But anyway, the thing is that, yes, it needs to be better. And I'm simply pointing out that there are parts where we know it does work. And I'm probably going to have a knee
Well,
operation.
again, you said it to me. I'm sorry that the health service isn't based around whether or not you can get seen or not. The fact is, it's incredibly inefficient. And until we wake up to that matter and fix it and try to fix it, we're never going to get anywhere. The fact is that there are 7.5 million people waiting on lists to be seen by doctors, right? There's a secondary list which has got another 10 million on it. So, practically a fifth of the nation is waiting for an operation or a procedure for more than a year.
I'm not dismissing that at all. And I think in what you've just said, I guess Wes Streeting would probably agree with you. There is a lot to be done. It could be a lot better, and it doesn't properly reflect the needs of an older population with a greater degree of chronic illness in it. And yes, all these things need to be improved. All I'm saying is, don't expect everything to be done in the first year of a government.
No, I'm not even blaming Labour for this. I'm just saying that why, after several decades of my life, has the NHS continued to get worse every single year? That's all.
Well,
you don't have an answer for that.
Well, all of those figures which you've just mentioned, if you go back 20 years, you will see that things were a lot better in 2010 when Labour left office. Spending as a proportion...
there were a lot fewer people living here then.
I don't know about a lot fewer. I mean, if you get on your hobby horse of migrants, then, thank goodness we've got migrants who are working in the health service. It would fall apart.
Yeah, but there's more migrants using the health service than there are working in it. Otherwise, the sums don't add up, do they?
I'm sure you'd like to publish the figures on that, because most of the migrants that you're talking about are healthy young men, and they are the least users of the health service. But it's older people principally who are the ones who are needing a disproportionate share of NHS services, and it's that demographic change.
There's lots of elderly migrants here as well. Many people have come to this country perfectly legally and brought many members of their family. So it's not about whether they're young men or anything, and it's not necessarily about migrants. It's just about the population increase has put more pressure on the NHS, and the NHS has got worse at what it does. It's as simple as that.
In places, it has, and these things need to be put right, and I'm sure Wes Streeting has a plan for doing that.
Well, I hope so. It doesn't seem like it. Anyway, listen, Tom, good to talk to you. Thanks very much indeed. Tom Levitt, former Labour MP and founder of Sector 4 Focus. I couldn't quite make out whether Tom thinks that NHS is brilliant or not, really. I mean, everybody can tell you that it's not brilliant, is it?